મેડમ તમે કયા નામથી આવો છો? Karuna ma'am, I'm admitting the participants now.
Okay.
Okay.
Yeah.
Waiting list.
Where is it?
Training member. Ankit Christian. Admit. Yes, Bingaji. Taruna madam is here.
Yes, sir. Hello. Good morning, sir. She is Sir Taruna Patel, reflecting over 3 seconds. Taruna ma'am, he is our principal sir, Dr. Anil Sharma, Professor Dr. Anil Sharma.
Hello, sir.
Hello, ma'am. How are you?
I'm good. How are you?
Yeah, I'm good. Thank you. Thank you for joining us.
Thank you for giving me such a beautiful opportunity to present myself. Thank you, sir.
It's our pleasure, ma'am. It's our pleasure. Thank you.
Thank you.
Just a minute.
Uh, shall we start, sir?
Yes, please, please. Yeah.
Uh, good morning to all. Myself, Beenal Joshi, behalf of Manikaka Global Institute of Nursing. Uh, I heartily welcome you for the session of today. We have posted a webinar on the title of Attention Deficit Hyperactive Disorder among the children. uh, we all know that this is the commonest disorder and it is a very chronic disorder among the children which is prevalent, and this mostly millions of children are affected by disorder, and uh, it gives a significant impact on child's development. Sometimes child may also have the conduct disorders in future, or sometimes they will have the antisocial behavior. And keeping this point of view in mind, we have arranged this webinar, which will enlighten and give us the depth understanding regarding what is this ADHD, how much it is prevalent, and what are the risk factors, how we differentiate a normal child and the child with the ADHD, what are the diagnostic criteria, what are the clinical manifestation, and how we should approach the child as a nurse, as well as how we should educate our parents regarding whoever is having such children. So keeping this view in mind, we have arranged this webinar, and for that we have a resource person with us, and she is Ms. Taruna Patel. I'll just introduce you with our speaker. Taruna Patel is a psychiatric nurse. She has cleared his psychiatry nursing in the year of 2012. Then she had cleared her NCLEX RN in the year of 2014. After that, she has served at Shamago Manor Rehabilitation Center for 2 years constant. And then after, she also offered herself as a volunteer in the FNP clinic for 6 months. Then after, she is right now doing and pursuing her MSN program from the Alabama University at Birmingham, and she is about to complete, and she has an expertise, knowledge and experiences working with the children and many more, like the criminal psychiatry and all that, and right now she's working with that. So we heartily welcome you, Taruna ma'am, and
Thank you.
we are thankful that you have given consent to us to host our webinar, and now we are handing over this session to you. So thank you, ma'am, and now over to you, madam.
Thank you, Miss Pino. I first of all, I'll start with the sessions. I would like to thank you, Dr. Anil Sharma, the principal, Mr. Vipin Bagaria, HOD of the Child Health Nursing, MTIN, and the CHARUSAT University to give me the opportunity to address such a wonderful session. So thank you all. Thank you so much. I hope you all doing good. So already the Binal ma'am introduced about the topics. So first of all, we'll start with the topics. You all ready? So a child with the ADHD. So first of all, I put the picture over here so you all can see. By the looking at the child, you can see what he's doing. He's not attending. He's not having any focus. Well, everybody are learning. The teacher is teaching the stuff, and he don't have any interest at all. So this is the symptoms we're gonna see in the further. So this is the child with the ADHD. So let's start to begin with the introduction. ADHD. ADHD is the one of the most common neurodevelopmental disorder of the childhood. It's a neurodevelopmental disorder. Neurodevelopmental disorder means they have a disturbance in the central nervous system, which may produce the symptoms like psychiatric disorder. Also, it seems to produce the symptoms like a psychiatric also and the neurological also. It's a combination of the disorder. It also usually first diagnosed in the childhood and often lasts in the adulthood. So we can, uh, everybody hear me, right? Miss Pindelman, is it I'm audible to you all?
Yes, ma'am.
Okay.
Yes, you are audible,
It
ma'am.
is.
Yeah, please.
Okay, thank you, sir. Thank you, sir. It also called hyperkinetic disorder. The other name is a hyperkinetic disorder. It's also the same word like ADHD. Unless and identified, the treated properly, ADHD may progress to a conduct disorder, academic and job failure, depression, relationship problem, and substance abuse. Means what? If the ADHD symptoms, if we not figure that out, that person is suffering from the ADHD, that may leads to the conduct disorder, like tics. What type of the conduct disorder? Like the child start to hitting somebody and like speak the bad words and start that type of the behavior. In the academic, it shows the failure, the job failure. Because of this stuff, it leads to depressions, relationship problems, and go to the substance abuse. Most children with the ADHD experience the signs and symptoms by age of 4. Few aren't diagnosed until they enter to the school. So why it's like that? Because ADHD symptoms are present before age of 4 also. But when the child go to the school, we cannot say like the child have some symptoms, and we cannot say like this child is suffering from the ADHD. We have to see how his child is behaving at home as well as how the child is behaving at school also. Because we think like some children are behaving good at the school, they are not behaving good at all at the home. So they consider it over here. They feel like when the children go to the school, the teachers also see how children are behaving in the school. Does it giving any attention or have any focus issue or anything like that? Then they diagnose like yes, this child is suffering from the ADHD. So we cannot diagnose the children before 4 years of the age. So in the India, a study had found that the prevalence of ADHD among the primary school children was 11.32%. Prevalence was found to the higher among the males, 66.7%, as compared to that female 33.3. So the male suffered more in the ADHD than a female. The cases is more in the males than the female. The prevalence among the low socioeconomical group was found to be 16.33%, and that among the middle social group was 6.84%. Means what? Like the 16.33% seen in the low socioeconomical. So the more cases seen in the low social economical status than the high economical status. So let me give you the brief introduction about the ADHD, who is the founder and who found that stuff. The condition was first described by Dr. Heinrich Hoffmann in the 1945. He was the physician who wrote the books on the medicine and the psychiatry. Dr. Hoffmann was also a poet who became interested in writing the children's when he couldn't find the suitable material to read to his 3-year-old son. The results was book of the poem, complete with the illustrations about the children and their characteristics. The story of the fidgety Philip, it was the title of the book, was an accurate description of the little boy who had attention deficit hyperactive disorder. Yet it was not until the 1902 that Sir George F. Steele published a series of lectures to the Royal College of Physicians in England, in which describe a group of impulsive children with a significant behavioral problem caused by genetic dysfunction, not by poor children reading. It's a child's hope. Today we can call that ADHD. The same stuff. They was not diagnosed it earlier, but right now it's called ADHD. The same symptoms carry out. So we go in the depth. So first we'll see the definition of the ADHD. What is the definition of ADHD? It is chronic conditions include attention difficulty, hyperactivity, and impulsiveness. These three words is the most important. If you understand these three words, it's going to be more easier to understand how the children are, what type of the clinical features children is having. So these three words have each and every criteria. It's going there. Like you can see, yes, this type of the criteria is going in the attention difficulty, or this type of the criteria go in hyperactivity. So we'll see in the detail each of the criteria, what it's come under the what stuff. Here I put some picture, like have an inattention, have a hyperactive, so very impulsive. It doesn't have stay in a one stuff. So in the first one, it's an inattention. Okay, in inattention, what criteria come under the inattention? Child often fail to finish what he starts. Child cannot continue what he's doing. Like child do some stuff, he go to the other way, and then he finish. Like he think like he cannot finish the work. He just start then stop. Child have a difficulty to concentrating or paying attention. He is a very distracted child. He cannot pay attention. Like he have a very difficulty in concentrating the thing. He can concentrate for 5 minutes, and after 5 minutes he just go. He don't stay. Child doesn't stick with the play activity. Often does not seem like he listen when he's spoken directly. Like child, when you spoke to the child, he think like you can see like child is looking at you, but child cannot understand what you are speaking because his mind is somewhere else. He cannot listen to you. And child often distracted by extraneous stimuli, like if he sees something, like he's learning right now and he hears some voices behind his, like truck voices or bus voices, you are not listening, but the child is listening that voices and get distracted easily. So you cannot think like I'm not hearing and he's, but yes, ADHD child have some special skill, like he can hear the extra voices and stimuli and they get distracted easily. In impulsivity, child often act without thinking and later he feels sorry about that. So what means impulsivity? Impulsivity means the child, he think like he want to stop, but because of the impulse is going on in his mind. He cannot stop that impulse, and because of that impulse, he feel like he do excessively stuff. So child often act without thinking, like he don't think like what he's doing, and after did everything he feels so sorry about that stuff. Child shift excessively from one activity to another, like he doing one stuff right now and in the next moment he do the something others. Child has a difficulty in organizing the work, like he have a very poor organizing skill, like he don't like to organize everything, like he messed everything. And what this type of the symptoms you can see in this type of the children's. Child needs lot of supervisions, like somebody supposed to be supervise the child all the time because he's very hyperactive. He do anything, he don't know what he's doing. Child speaks out loud in the class, like if somebody asks the question, of teacher is asking the question to everyone, but the child is very hyperactive, without telling his name he just stand up and tell like, I know, he speaks so loudly. He never wait for like, this is my turn, I have to wait for that. But due to the impulsivity he can't do that. And in the hyperactivity, the child runs about the climb on things excessively. He likes to jump, he likes to climb, he do excessively. The normal childs also do this stuff, but the ADHD childs do excessively, more than the normal. Childs can't sit still and fidgety. He feels so restlessness all the time. He feels so restlessness. Child have a difficulty staying in his seat and bother the classmates. Like he feel like he is so hyperactive and he doesn't like if somebody is sitting quietly besides him. He like to irritate the others. He like to do something to the others. Child excessively active during the sleep also. He can't go for a sleep so nicely. If like he very active during the sleep also. Child always the go and act if driven. So he wants to do something. He don't want to sit down for a minute. He just want to do everything excessively. He talk excessively. Sometimes, like, if you ask about something, and if you ask about the some one word and he give the more information than you ask, so he talks very, very, very much. And in emotional instability. So in the emotional instability, you can see the angry outburst. He get angry easily, he scream, he yell, he do everything. He's a social learner. Means what? Because of this type of the behavior, like some children, they don't have a friends, he doesn't have a friend. Because of this type of behavior, he cannot maintain the relationship with others. So what happened? He becomes socially alone by himself. Childs blame others for the problems. What happened? Like, he do something, but he like to blame to the others, like he did that, I didn't do that. Childs fight with the others quickly. He don't have patience, like he don't listen to you. He just like to fight. He just fight with quickly without thinking anything. And child's very sensitive to criticism. Especially I seen in the most of the cases over here also, children doesn't like to be criticized in like in front of anybody. I seen, like, when I work here, I seen many type of the children, they doesn't like if you socially criticize them. Don't like it at all. So in India also, like, as we criticize everybody, like every children's in front of everybody, but we're not supposed to criticize them. So this is point to learn for us also. Like, there the special ADHD child is very sensitive to criticism, but I think the most of all child have sensitive to criticism. They doesn't like if we criticize in front of everybody. So we already saw, like, what type of the symptoms come under which stuff. So here is the types. Like, there are the three type of the ADHD. What is the first type? It is a predominantly hyperactive impulsive. In this, the majority of symptoms, 6 or more than 6, are in the hyperactive impulsivity categories. There are less than 6 symptoms of inattention. However, inattentions can still be exist to the certain extent. Means what? Here is the, like, it's a hyperactive impulsive. It's not inattention. So here the more than 6 symptoms you can see with the hyperactive and impulsivity, and less symptoms with the inattention. But the inattention is still there, but it's not like not more symptoms you can see, but it's still present in this type of the ADHD. Predominantly inattentive. So we already discussed, like, how they have a criteria which comes under the inattentive. So here also the most of the 6 plus are part of the inattentive category, and there are usually less than 6 symptoms of the hyperactive impulsivity. However, the hyperactive impulsivity may still be persistent to certain extent. Children with this subtype are not as likely to act out or have any difficulty to getting along with other children. They may also sit quietly, but they are usually not paying attention to what they are doing. Therefore, it is common with this subtype of the children to be unnoticed because the teacher and parent don't recognize it. Here, what happened, like, especially the inattentive child, sometimes they act like they are very hyperactive, but especially this type of the child, they may be quiet. They don't talk much with anybody. They don't like to socialize with anybody. And what they feel like they are a very shy child. They don't understand. But they need to pay attention of this type of the children also. They're not shy, they have some problem. They don't like they don't know how to interact with the other. So we need to recognize, like, children, even the teacher and parents also can't able to recognize, yes, the child is suffering from this type of the disorder, because he's so social introvert, he's not extrovert. So this type of the symptoms in the inattentive, you can see this type of the symptoms also in the children. And the third one is a combined hyperactive impulsive and inattentive. So there are 6 or more symptoms and sign of inattention and hyperactivity, impulsivity present. This is the most common subtype of the children's. So most of the time we see this type of the symptoms present. It's a combination of hyperactive, impulsive, and inattentive. So it's a called ADHD. Most of the time, the 60% we see this type of the children with the all symptoms present. Next, we'll see the etiology. What the possible etiology for this? What do you think? So first one is the genetic factors. Genetic factors. There is a greater chance in a monozygotic than a dizygotic twins. Means what? The identical twins have a more chance than the dizygotic twins. Sibling of the hyperactive disorder, like children, have about the twice risk of having the disorder as does to the general population. So sibling who have hyperactive, the one brother he's a hyperactive, the other child may be possible he is also be a hyperactive, have some other symptoms like only inattentive or just hyperactive, but yes, there is a chance he also get that type of the disorder. Third, the higher incidence of ADHD seen in the children with the family history of ADHD, whose parents is suffering from ADHD. There is a higher incidence of seen in the children with the ADHD. The hereditaries play important roles in ADHD. So, what is the neurochemical factor? A deficit of a dopamine and norepinephrine has been attributed in the overactivity seen in the ADHD. This deficit of the neurotransmitter is believed to a lower threshold for the stimuli input. So we all know, we all learn in the anatomy what the dopamine do, or what the non-epinephrine does. So what happened? That's the neurotransmitter. The neurotransmitter are the chemical messenger. They send one message to the other neurons. So what happened? The dopamine have some functions. Non-epinephrine also have a functions. Like the dopamine is usually used for the focusing and behavior cognitions. So if there is a lack of dopamine, non-epinephrine also used for sleep, arousal, focusing. So if there is a lack of there or the decreasing level of dopamine and non-epinephrine is attributing in the ADHD, the still research is going on there how they have a deficit in the neurotransmitter, but they still didn't get any results. Like they didn't get any thing which prove that. In neuroanatomical factor, a review of MRI suggests that the population of children with the ADHD shows evidence of the both decreased volume and decreased activity in the prefrontal regions, anterior cingulated, global pallidum, caudate, thalamus, and cerebellum. Means what? The MRI, they did MRI and other stuff also to get the review about the anatomical, how the anatomy looks like in this type of the children. And it shows like they have a decreased volume and decreased activity in the prefrontal regions. We all know, like we have all the four region, temporal bone, parietal, frontal, occiput, all have that proper functions with everything. So what the prefrontal region is used for? The prefrontal regions have a function, like have executive functions. They do the reasoning skill, personality development, thinking, voluntary movement, what's supposed to do, what not supposed to do. Everything is handled by the prefrontal regions. Anterior cingulated also useful for empathy, emotions. Global pallidum caudate is a part of the basal ganglia, and they're also useful in the movement. So it helps to involuntary movements. What type of the involuntary? Like if you think like I want to hold a glass, that type of the parts is help. Like yes, I want to hold this glass, or yes, I want to go there. The voluntary movement. This type of the basal ganglia is helping to give us direction. What we have to do. The thalamus is helping. It's a relay station for a sensory information. It's processing center. And the cerebellum, obviously we all know, is a postural tone. So these all are helping us. They are giving the attention to us. They are helping us to get to know about the stuff. But if there is a decrease in the volume and decrease activity in these anatomical parts, it's also show that the ADHD child. Psychosocial factor. What? The severe chronic abuse and neglect. What type of the abuse? A child who suffered from a physical abuse, mental abuse, or any sexual abuse. We can see this type of the children in the ADHD. A neglect, the child who got neglected when he was child and got the neglect, or he faced this type of the stuff, he also find like it's related to the ADHD. Developmental factor. What it's included in the developmental factor? There is a prenatal toxic exposure, prenatal mechanical insults in the fetal nervous system, prematurity, fetal distress, precipitate for or long or prolonged labor, perinatal asphyxia, postnatal infection, CNS abnormality resulting from the trauma. So developmental, when the child was in the tummy of the mother, that time also if the mother exposed to any toxic exposure or have a prematurity or have a fetal distress when he was born or had a perinatal asphyxia, all type of the symptoms can affect and child can get. And there is also, they also says like the child who get the more sugar, more addictive or more foods with the preservative, also you can see the hyperactive disorder in that type of the children's also. Here is the another risk factor that trigger the ADHD, the gender. We already seen that ADHD girls is less common than in the boys. So it's a very less common in the girls than the boys. Boys have more cases of ADHD than girls. In the hereditary also, I already told you the hereditary play importance role. Like who have a psychiatric history or a ADHD history in the family, there is a more chances the children also get the ADHD, especially in the twins. I told you the identical twins have more chance to get than the diagnosed. Okay, in the age, generally the risk is a higher between age of 3 to 6. Maternal factor, the high blood pressure, smoking during the pregnancy, mental health condition, and increase the risk. Toxins, being exposed to some toxic or some pesticides may be high risk for that. Premature birth, if baby is born before start of 37, like if I have any premature pregnancy, they also lead to that problem. Head injuries, some heart condition, tunnel syndrome, they're also associated with the ADHD. So let's see the clinical features. In the clinical features, we already talked about what type of the symptoms seen in each and every area, but we see the overview, like what type of the symptoms we can see in here also. Sensitive to the stimuli, child sleep more than a growth and development, see slow in the first month of the life, general coordination deficit, short attention span, easily distractible, failure to finish task, memory and thinking deficit, and specific learning disabilities. You can see all type of the clinical features in the children. So what the clinical features at the different age group? Like if the child is in the preschool, like 1 to 3 year of the age, like 5 year of the age, you can see the children have a very hyperactive, he don't stay, like he likes to move here and there, very impulsive, and like he do one thing right now and going to do another thing in the next moment, not flexible, he doesn't like to follow the instruction. May get the angry at peers. He don't have a good relationship with the peers because he get angry. He have fight with the peers all the time. In the elementary school, so like what type of the symptoms seen in the elementary school children? He struggle with the listening classes. He doesn't pay attention to what the teacher is telling. Poor organizational skill, he have a not good organizational skills, struggle with the social interactions. Because of this type of the behavior, he always struggles. Like I seen the most of child, like most of the children who struggle with the social interaction. Why? Because of this type of the symptoms is present, they get angry easily, they don't have a good relationship with the peers. So what happened? Nobody likes to talk with him, and he feels so socially isolated, and which makes these symptoms more worse. So we have to pay more attention, we have to pay more, as a nurse also we have to pay more attention when you see this type of the children's. We also see the difficulty function independently. He can't do anything by himself, he needs somebody to help him all the time. In adolescence, you can see the academic demands become overwhelming, uh, and struggle with attention learning executive functions. Means in the adolescence, like if somebody tell like you have to finish this assignment in the 3 days, he not going to do that. It feels so overwhelming, like because he's not giving any attention, he can't keep up with the things. If he pay the 20 minutes, then he wants to do something else, he cannot stay for more than 20 minutes. So what happened? He become overwhelmed, and he have a like struggle with the attentions learning executive function. He's not going to able to do the executive function as he used to be. So let's see the diagnosis. Before we move to the diagnosis, I want to let you know that these type of the symptoms we can see, like here I can see, you're all thinking, like after seeing all the symptoms you can thinking, yes, we can see these symptoms, the symptoms in the all the children's. Yes, we are see this type of the symptoms in some time, like all have temper tantrums, some people like to yell or everything like that. But we cannot diagnose that, like yes, that person or these children have a particular symptoms, and we diagnose, yes, he is a ADHD or he have a ADHD symptoms. So we see the diagnosis, how they are giving more importance to diagnosis, how we have to rule out, yes, this person is suffering from ADHD. So let's give the diagnosis. Okay, in diagnosis, first one is a history collections. Always, history collection is the most important key in any disease, and especially in the psychiatric, history collection is must, and it's a very important. It's play very important role. So what we're supposed to do here? The complete medical history from the parents. We have to ask the parents, like how the he was born, does he cry or not, how was your pregnancy, did you expose to the any chemicals during the pregnancy, did you smoke during the pregnancy, did you have a alcohol history during the pregnancy. We have to ask everything, like when she was pregnant with that particular child, we have to ask everything, perinatal history, postnatal history, and when the child's born, how was he had suffered any problem, or he suffered any disease or anything like that. We have to thorough with the medical history, because what happens sometimes, let me tell you one example. Sometimes some medications also give you a side effect, like if you take the any hypothyroid medication, which makes you hallucinations or delusion or anything like that. So we cannot figure that out, yes, this is the person suffering from psychiatric disorder. No, that medications cause that persons to that particular symptoms. So we have to see the medical history, we have to see what he's taking or what he's doing. Does he have any substance abuse, he have anxiety, we have to figure that out. We have to take the behavior history from teacher. So here what they are doing, they cannot diagnose the child with ADHD before 4 year of the age, because they take the history from the parents also, and they take the history from the teachers also. Sometimes I already told you that, like sometimes children behave very good at the school, and they don't good at all at the home. They doesn't like to play at home, like he always screaming, yelling and everything. But in the school they behave very nice. So we have to take a complete history about the behavioral to the from the teacher also, like how he's behaving in the school. Does he have any attention issue, or have a poor focusing issue, or have a fight with the children. We need to all the details from the teacher. Then the complete medical evaluation, such as hearing and vision test, we have to make sure, like does he have a hearing problem or visions problem, because of that's he's not hearing. We think like we are telling him and he's not hearing at all, and we just scream back to him. But sometimes he have a problem with the hearing and visions, but we need to rule out this type of the stuff. Then rule out the condition with the similar symptoms which may coexist with ADHD, such as anxiety, depression, substance abuse, conduct disorder, and learning disorder. Means what happened, sometimes the child is suffering from anxiety or depression, also show the same time of the symptom, like the anxious child. He doesn't know like how he has to express his anxiety. He not going to talk with anybody. He feel very hyperactive. Sometimes he feel very sad, don't talk with nobody, get angry immediately, because he don't know he has to act for anxiety. So we cannot tell like he has a ADHD. We have to rule out, we have to see like what type of the symptoms is present, how long the symptoms are present. Some child have a learning disorder like dyslexia. They cannot understand what is written in the book, and like have a learning problem, some other learning problem. So we cannot have a some sort attention span. So we have to rule out everything before making diagnosis. Making diagnosis is very important in ADHD and in all psychiatric disorder and all the medical disorders also. The DSM-5 criteria, what we are doing, we have, like if the child's come here, let me tell you give you a little brief introduction about the DSM-5 criteria. there is specific criteria which comes under there is specific symptoms supposed to be present for this particular time and everything, then we can make a diagnosis of that. So for the DSM-5 criteria, this says like 6 or more symptoms of inattention for children up to 16, or 5 or more of adolescents 17 and older and adult. Symptoms of inattention have been present for at least 6 months, and they are inappropriate for developmental level. So these type of the symptoms uh, 6 or more symptoms supposed to be present. Which symptoms we saw earlier, that 6 or more symptoms supposed to be present for a 6-month period. We cannot say for 2 weeks the child was behaving that way. We cannot say like yes, child have ADHD. No, that symptoms supposed to be present for at least for 16, like 6 months. And we need to get the detailed history from the parents, detailed history from the teacher, then only we can able to diagnose yes, he's ADHD or he have this type of the particular symptoms is present. I already told you about the clinical history, what they are doing in. So the qualified health professional usually collect the information about the child and his or her behavior and environment, like what about the environment he's living. Sometimes childs are getting very abused and they behave like that. They got like they don't know, they don't like the environment at the home, like parents have abusive or the not good environment, like substance abuse. They have a lots of parents who have a substance abuse, and they don't treat the child good at all. So we have to get the collect history regarding behavior and the environmental. Pediatricians can evaluate the child, but most of them refers the children to the mental health specialist who has had experience with the childhood mental disorders such as ADHD. Either way, the first step for the doctor is try to rule out of the other possibility of the symptoms. This ensures that the behavior of the child is not caused by certain occurrence, previous happen, or health condition, which could appear symptoms of ADHD. I already told you, like we cannot, by looking at the symptoms, we have to see everywhere we have to see the medical aspect, the environmental aspect, home aspect, teachers, what parents are telling, everything. We have to do mental status examinations, how child are performing. We need to ask some certain question to the child, and then we can figure out yes, the child have symptoms of the ADHD. So next we'll see the treatment goals. In the treatment goals, we have to set some goals. First, the child-specific individualized treatment programs should be developed for children's. A goal of maximum functions. Third is to improve the relationship and perform at the school, to decrease disruptive behavior, promote safety, increase independence, and improve the self-esteem. This is the stuff we have to keep in our mind. We need to do to the children, which we can help him. So in the treatment, there is no cure for ADHD. The only treatment existing simply reduce the symptoms for many people. It's so sad about that, but there is no cure for ADHD. ADHD, it's still there. We can minimize the symptoms, we can reduce the symptoms, but there is we cannot cure the ADHD. So what the treatment they are prescribing? They are giving the CNS stimulants, antidepressants, high blood pressure medications, and serotonin norepinephrine reuptake inhibitors. So let me tell you in detail. What they are doing, first they give the CNS stimulants and non-CNS stimulants. I wrote some medications over here, the Ritalin, Focalin, Dexedrine, Adderall. They are using over here as a pharmacological treatment. It's a CNS stimulant. But what happened, especially in the medications, sometimes some medication work good for some children, sometimes that medication doesn't work at all for some other children. So what we have to do, it's a trial and error. Like they start with the low dose and they see like how children are doing, they see the side effects, does child have any side effect or not, then they can continue with the other medication. And the non-depression medication, the non-depression like Wellbutrin also works good for the children. Especially the CNS stimulants work good for the children because it increases the dopamine and norepinephrine level. where other non-stimulant drugs which also helpful, like clonidine is helping to reduce the hyperactive, then serotonin, it's also helping in the focusing. So all are helping the ADHD child, but the stimulant work best for them. But sometimes what happen here, it's a dependence, like child, if you give the stimulant to the children, sometimes the children get dependence on them. So what happened in the adults over here, we can see the most of the patient who have a like drug seeking behavior, where I already seen many people who come here, they come only for the drug, because they feel more focused when they take the drugs like Adderall, giving them a more focus. So because we have to figure that out, like this person is suffering from this disorder, but he's just acting, he just want to take he's a drug seeker, he just want to take a medications, that's it. So we need to figure that out. For that type of the adolescents, they provide the different type of the non-stimulant drug, so they don't depend on the medication. But first of all, they start with the CNS stimulant. If they don't work good for them, then they start the non-CNS stimulant, and they see the how the medications work for it. It's a difference, like it work differently in each and every child. So they see like what type of the drug doses work for the one child. Sometimes it doesn't work good for the another child. So they're changing the medication and see, and this type of the thing they give the like treatment to the child. With the medication, we also provide the psychological therapy like behavior or modification techniques, cognitive behavior therapy, and social skill training. We'll see detail about the therapy. So this is the important parts for the nurses, right? What as a nurse, what we have supposed to, what you're going to teach to the parents, like we have to learn like how, first we have to learn what about the behavior strategies for the ADHD child. So here they tell like the ADHD child, we have to put the use the alarm or create some charts, create some checklists, set alarm. They are very useful for them. Why? When they use a timer, they get to know like, yeah, it takes 20 minutes for them to finish this work. They get to know like, yes, they learn how time management, create a charts. Sometimes what happen if they see anything different like that, they feel very impulsive, they feel very hyperactive and get angry. They like the same environment all the time. I seen over here the children's like the environment what it used to be. Children do not like the, like if we changing the environment all the time, they do not like it at all. So we have to create the checklist like daily what you're supposed to do, like take a lunch or a schedule. We have to put everything in the schedule so children can do everything in the schedule and help them to come over with this type of the conditions, set alarm and everything. So these type of the behavior strategies they provided to the ADHD child. So what the parents learn when trained in the behavior? This is the big part, right? As a parents, sometimes what happened, first of all, in the India or any condition, first of all, they don't like understand like, yes, my child is suffering from the ADHD, or they don't accept at all. But we have to tell the parents it's supposed to be positive communications with the children. We have to tell parents positive reinforcement with the children and structure and discipline. Positive communications. We're not supposed to yell on children and tell them, yeah, you are not like you are good for nothing, you are not doing this. See the other children. We never supposed to be criticize children or never ever compare the children with the others. This is the first one we need to learn. Positive reinforcement. The child's do anything good, we have to give the positive reinforcement to them, so he feel like, yes, I need to do more good than this one, so I get more bigger gift or something like that, so they feel very good. So positive reinforcement play a very important role. And structure and discipline, I already told the everything, the environment supposed to be structural and discipline. It's really helping this type of like in this type of the condition. Parenting strategies for the children with the ADHD. Provide the positive attentions, like whenever child asks you like I want to do, please give the attention to the child. We have to give the positive attention to the child. Don't ignore the child. If he's asking lots of questions, just give the attention, give them response, give effective instructions like what you're supposed to do or what you're not supposed to do. Teach them some like basic stuff, to tell them about some basic task. Then praise your child effort, like you have to give the child like basic stuff or like, and whenever the child do that stuff, just need to praise, yeah, you did a good job, and encouraging word, you are doing great job, that's awesome. So these type of the words make the child feel better. Even our, like, if we do something good and somebody praise us, we feel, yes, we need to do more better than next time. So the same in the children's also, if you praise more, they do more good. Establish the rewards, I already told you, like if y'all like the children is doing anything good, we need to give rewards, so he or she feel like, yes, I need to do more good, and use the constant. Okay, helping your child who deal with ADHD, as a parents or as a patients or as a nurse or everybody, we have to be patient and understanding. Seek as like need to tell the parents, seek as much as help is possible. As a nurse, we teach the parents, like if you see these type of the children, or in not as a, like if you live in a society and you see this type of the children, you have to give the guidance to the parents, like, yes, you can like take a help from somebody who have expert in this. Then communicate with the teacher and guidance and counselor at your child's school. You have to tell them, like they can talk with them. And nowadays I can see there is a lots of school have a counselor. Sometimes the children doesn't know, like don't like to talk with their parents, but they can talk with the counselor. So yes, we have to tell the parents, like they can do that, and the parents also communicate with them. Accept your child and the disability of ADHD. This is the big one. This is the big one. If you accept your child as your child it is, and accept the disability of the ADHD, like, yes, child have ADHD, you have to accept. When you accept, you try to do like how I have to work on that. But if you are not accepting that stuff, I see many parents, they are not accepting at all. Like, I don't like my children does not have a ADHD, and which makes them more worse symptoms I seen. So just tell them, like they accept the what it is and come over with this type of the disorder, and take the every step you can help the child stay on track, organized, focused, and responsible. Prognosis, we see the prognosis, how the ADHD prognosis is. The 80% of affected children symptoms of ADHD persist into the adolescent and adulthood. With increasing age, hyperactivity is decreases, inattention, impulsivity, disorganizations, relationship difficulty persist. If not properly treated, individuals across the age span are at the risk. So if you don't treat properly, when he go like day by day, what happen, sometimes if you don't treat that person, he feels so socially in comfort, he don't know how to talk with somebody, he feels socially alone by himself, and day by day he feels depressed. And sometimes it's come, like I say that up of the people, like sometimes they feel like I have to go for suicide. They're like, nobody like me, or nobody loves me, nobody give any attention to me, and they go for a suicide. So we need to see, like, yes, the children is suffering from this type of the disorder, we need to know about that, so we can like decreases the risk, right? And with the combination of the medication and psychosocial behavioral intervention, most children's symptoms are like working. Yeah, it's working good. Medication and psychosocial therapy, it's working awesome. Like they can minimize the symptoms. It doesn't cure the disease, but yes, absolutely, it is minimize the symptoms, and like children can live their life as a normal child. So what is the role of nurse? What as a nurse you have to do? Okay. First of all, develop a trusting relationship with the child. If you are working as a psychiatric nurse, or if you are working as a pediatric nurse, or you see this type of the child who come with the parents, what you have to do? You have to increase the trusting relationship with the child. Child's not going to talk with you all because he doesn't know at all. So making the trusting relationship with the child, convey the acceptance of the child. As a nurse, also we have to accept, like, yes, child have this type of the problem. Remove the object from uh, remove the objects from immediate area in which patients could injure self due to the random hyperactive movements, identify deliberate behavior that put the child at the risk of injury. So what we have to do, we have to remove the we have to provide it the good environment to the child, so he do not get hurt or don't have any risk of injury. Provide supervision potentially, then okay, provide the supervision dangerous situations. So we have to provide them, supervise them, the children all the time when they come to the clinic. Give the immediately positive feedback and accept the behavior. Provide the quiet environment, self-contained classroom, and small group activities. We have to provide it the small group activities. Avoid the stimulating places such as cinema halls, bus stop, or other crowded places. They get very much stimulants and they feel very like hyperactive and everything. So we need to avoid that type of the stuff. Help him to learn how to take a him or turn or wait in a line and follow the rules. Like, see, nothing's gonna be learn. He's not gonna learn over the night. It take particular time, so we have to tell him, we have to give the small task to him, like, yes, you can do this or you have to do that one, so he can follow the simple rules and regulations, so which can help him to learn the behavior stuff. And provide the positive parenthood. This is the most important thing, right? The parents supposed to be understand, and they have to give, if they put a most effort, the child's also learn how to deal with that particular stuff. So understand me, I'm not bad. I have ADHD. So yes. So before I conclude my class, I want to let you know, before I want to present a case which I seen before the 2 months when I started clinical. I seen the patients, like a child who was 8 years old when he got there, and when he was got there, like a doctor start asking history and everything. So he asked what the medical history and everything, like ask about the teacher viewing. So what they did, the mother like explaining about that stuff, like, yes, child is not behaving good, he's not focusing at all, he doesn't like to play with others, he have a social, he's like socially learners in the school also, he's not behaving good at all, he fight all the time with the others, and she start telling history and everything like that. Then we asked about the family history, but she told yes, she doesn't know about the family history because the child was adopted by her, so she doesn't know like who was the biological parents of the child, so we didn't get that history. But and symptoms it presenting was like that, and that child was doing from 8 months, he was doing the same symptoms like that. So what happened one day when he was in the school, everybody like teasing him, like, you are not good for all, you are like that, you don't pay attention in the school. And in the day by day, child feels so ashamed about that, he feels so embarrassed, like whenever he go, he like, you can tell, yes, this child is very different from the other children. And he also feels so socially feels so bad about himself. So what he did, he tried to kill himself at the age of 9. He tried to kill. So the mother, he got that child at the clinic and tell yes, my child was doing such a stuff, can you figure that out, what's going on with him? Then they figured out, yes, the child, they see all the history collection and everything they did, and say, yes, child is suffering from the ADHD, and they diagnosed like ADHD. Then what happened, like they start the medications, like they start the pharmac medications, they start the stimulant like Adderall, they start, and it works good for him. So first of all, here also in the treatment, they start with a small dose, and if he works good, and if we see like he doesn't have any side effect like Adderall or CNS stimulant, what happens sometimes, we cannot give that type of the medication with the heart patients or any cardiac deformities who have suffering from that. So what they did, they got the they ask about everything, and that medication is working good for him. So after the short acting, then they put him the long acting CNS stimulant, and it's working good for him. They started yes, therapy also they started, behavioral therapy they started, parenting therapy also they started. They teach the parents how you have to behave with a child. We also get, as a parents, if children who do this type of the stuff, parents get irritated also, like yes, the child is not listening to him or anything like that. So yes, we have to give therapy to the parents also, and to teach them like how they have to behave with the children, how have they have to set some priorities, or give the small tasks to the children, or how to encourage the children to talk with the parents. And some behavioral therapy at the school also, that all teacher also. And especially in the US, they have a special school, like we have a school, but have a specially for the specialized, like who have a special child, have other classes, so they give more attention. The teacher can give them more attention to the children's, so we can, the children, so teacher can see, yes, give more in the learning stuff or focusing stuff, provided more time to the children than other child. So they have a special classes over here, so they provided that way. So day by day they improve his conditions. And the therapy also, like they provided individual therapy to the child, like how he have to behave. They start giving reward, and put set some boundaries that you're not supposed to behave such a way, some behavioral stuff. It's like did everything, and everything worked good for him. Then he was continue with the medications and therapy, and both work awesome. You can see the work awesome. When I see the child before 2 weeks, and he was doing absolutely good. You can see the difference between he was before 2 months and after that, it you can see the change. So in our society also, sometimes we cannot find figure that out. Yes, his child is suffering from the ADHD. Especially in India, we feel like, yes, this child is a very naughty, he's not listening to us, he's a very hyperactive. Yes, some child have a temper tantrum, have a some time of the problem, we accept that. But if we have to see this after this type of the symptoms which I presented, if it continue for the long period of time, we have to see, we have to give attention as a child. And so parents, we have to see how the child is doing, as the school, how is child behaving in the school also. So they can provide it good they can contact with the psychiatric doctor or the pediatric doctor and see what the children is going through, so we can figure that out. And in the US also, if child have such type of the disorder, feeling so socially insecure and everything, they go for suicide. And they have a day by day the suicide rate are increasing. Why? Because sometimes we are not figure that out. Yes, child have some problem, we feel like child does not want to talk with us, that's why he's behaving such a way. We cannot understand what's going on in the child's mind. But yes, if we have such a knowledge as a nurse, we can tell the patients also how they have to behave, or how parents supposed to be behave with this type of the child. And as in the society, we can tell the neighbors, if you see this type of the children, so you can educate them. You need a seek a help, you can go, you seek a help, you can go with your child to the doctor, so doctor can advise you. So this is the a main stuff. So ADHD, we have to learn, and we have to see it's a not common we seen in the all the time. We have to be seen seriously thinking about the disorder. It's sometimes it's put in the high risk though for suicide, and many did that. Many did the suicide because of ADHD, and then parents didn't rule out he was suffered from the suicide ADHD. So this is the time, so we can figure that out. Yes, we have to give more attention to this type of the child, and we can get to know, we can get thorough knowledge about that, how it's supposed to be. But yes, this is the way.
So, thank you, madam, for such a detailed description of ADHD and in detail information regarding the therapeutic diagnostic approach and the role of nurse. Uh, Thank you very much, madam, for this wonderful and informative session. I would like to request Dr. Anil Sharma sir to conclude the session, sir.
Are you going to invite questions?
Yes, sir, but in a chat.
There is no question.
What is
Okay.
your question, sir?
I think the
No,
session itself was very explanatory. Like it was a well concised, session. Though the situation or the topic which has been identified for the talk is, the prevalence of this topic is very high. I hope every house may feel such situation. Wherever you find the kids, you will find such situations. More or less, whether it can be a day to day or as on a continuous basis, you will find such. And the way you dealt with it, it was really wonderful. So thank you so much, Tarunaji, for joining us and enriching all the participants with your expertise.
thank you so much to providing such a good opportunity, sir. And I'm very thankful to Miss Pinal ma'am who coordinate everything and she did a wonderful job. Thank you, ma'am. And thank you, sir. And I also like to congratulate the MTIN team for your sincere effort in a response to organize such a informative sessions constantly. So I'm very thankful for that.
Thank you, ma'am.
I hope
Yes,
everybody understand. I try to provide like simple way so everybody can understand. So
yes, it
try
was.
to
It was.
put everything yes easy. So
I believe everyone was following very smoothly.
I hope I like somebody gained the knowledge.
I gained.
Yeah.
I gained actually.
So thank you, everyone. Thank you, sir. Thank you, Taruna ma'am. Thank you, my MTIM team, and thank you all the delegates for your active participation for the sessions. And we have a wonderful participation in the session. We have 100, and on the YouTube also we are having the 50 participants.
Thanks all to students. Yes.
Feedback link is shared in your chat box. You can fill your feedback, and you will be receiving a e-certificate. The email ID you will fill in the feedback right away. So again, I'm concluding the sessions with a vote of thanks to everyone. Thank you, sir. Thank you, ma'am.
Thank
Invite
you.
Tarunaji here. Meenal ma'am, invite Tarunaji here once the things get normal.
Yes, sir.
So we will
Sure.
have,
Yeah.
physical session here.
So
Yes, definitely.
she's very fond of festivals, so she did
Okay.
not miss out the Indian festivals. So once a year she visits India.
So when I'll come there, I definitely come and see you all.
Please do come. Please do visit us.
Yes.
Yeah. Stay safe.
Thank you so much, sir.
Yeah.
I really appreciate. Thank you.
Bye.
Yeah.
Thank you, sir. Taruna ma'am, now you can, if you
Yeah.
want to, you later.
Okay.
Thank you, ma'am.
Yeah.
Please, whoever is watching on the YouTube, feedback link is also shared on YouTube. You can fill out the feedback link, and right away you will have your certificate on your registered email ID. With the email ID, you will register the feedback link. You will receive your certificate on your email ID right away. And again, I'm very thankful to all of you, dear delegates. Your active participation motivates us and boosts us for planning such sessions. So, thank you for your attention and your active participation. Thanks a lot.
Thank you, ma'am.